Well, thank you very much for inviting me to be here and talk a little bit about what we're doing in the exchanges, but I want to put it in perspective. I wasn't here earlier, so I don't know how much background you had on the exchanges and what actually the insurance departments around the country are doing, but let me just give you a little thumbnail sketch of what we are doing as a division and then what we are doing nationally as all the insurance departments, because I just want to put in perspective for you of all of the different things that are going on, and so why what I have to say about exchanges may not be as detailed as some of you would like. Right now, the division is working on a number of issues. We probably have 6 to 8, maybe even more, like 12 conference calls a week since this bill was signed into law, from everything from financial exams to fraud to rate review to medical loss ratios that are going on a weekly basis, along with calls once a week with HHS to determine all the moving parts on the health care reform. And then I'd like you to think about adding on the layer of the bill that the President will be signing tomorrow on financial regulatory reform, which will greatly change the face of insurance regulation in this country. So we have got so many moving parts that it really is a testament to our staff to make sure that everything is going as well as it is, on top of all of our regular duties. So right now, the #1 focus of our office is not the exchanges, to be quite honest with you, because we have until the end of the year to figure out the medical loss ratio, which is really a critical component of health care reform. On top of that, we are to have rate review, and I know many of you have talked about why Iowa didn't request a grant, and if you'd like to talk to me later, I'd be happy to explain why we didn't do that. On top of that, we've been trying to roll out our new high-risk pool under the federal guidelines and get that up and running. At the same time, we're trying to put all of that into a new website, which is required to have some of this information. In addition, by the end of September, we have to make sure that we have model laws on rescission procedures, some of the immediate reforms. We have to have consumer information, we're working on standard definitions and explanations of coverage. We have just a lot of things going on. So on top of that, as you know, the state of Iowa already has an exchange law requiring consumer information. We're working on that right now. We have to have a business plan by the end of the year, and we're working on that. In addition, we have asked Iowa Interactive to help us formulate what the cost would be and how it would take to implement the actual exchange on the website. We've met with DHS and Charlie Krogmeyer and some of his staff about making this blend together. The last thing we want to do is reinvent a wheel that it's not necessary to be reinvented. Now, if you add on to that the fact that in our conversations with HHS, we have not really gotten concrete information about what they envision in the exchange and other items of health care reform, you can imagine that it's a little challenging right now to figure out what moving parts we should actually be focused upon. Because of some of this is really, there are 10 parts in the health care reform bill that state that the National Association of Insurance Commissioners will put these standards together and the model. And so we have a series of conference calls, but mainly and most importantly this week, on Thursday and Friday, we will be having a series of public meetings in Washington, D.C., where all of the important stakeholders, along with the commissioners from around the country, and we hope HHS will be there, where we will have almost 2 full days of meetings, including a full day on the exchanges. We have a subgroup of 2 commissioners from Pennsylvania and Illinois that are trying to put more of a template together so that when the states do their exchanges and when we interact with HHS, we can have something that consumers, whether they're moving across state lines, feel very comfortable with the operation of the exchanges. The last thing we want to do to consumers, as we know consumers are more mobile, that when they go to Iowa or Pennsylvania or Florida, wherever that exchange is, that the information looks roughly the same. It's very interactive. They can get the information on whether it's a government-sponsored program or a private program. So I don't know if there's the ability to listen into these calls, but beginning on Thursday, we will have an exchange group. Then we will have the consumer information group. We also have a uniform fraud reporting subgroup, and more of the exchange and the consumer. So kind of my message to you right now is I wish I could tell you more of what the federal exchange is going to look like. In conference calls we've had with certain officials at HHS, they basically said, we're not really sure what we envision at this point. We're really waiting to see what the NEIC comes up with. Our hope at a meeting tomorrow with HHS and a call with HHS as well is that they will give us some more guidance. I think the concerns for commissioners is that we don't want to run down the road, put a model together or what we believe the exchange, how the exchange should interact, and then have spent a great deal of time and then HHS says that's not really what we contemplated. And I think that's kind of a challenge for us on a lot of different fronts going on right now. In addition to that, as we're putting together our information exchange at the state level right now and gathering all the information from our current stakeholders, we want to make, maybe that's the template we can build upon. But we also know that in the next 3 to 4 years, we will probably have carriers out of the market. We will have consolidation. We don't know how the exchanges will interact with our producer community. We know that there will be costs to set up an exchange, and I know the legislature gave us about $150,000 to work on that. So what will the grants be from the federal government? We know that the grants will be available to states to do the IT and set up the exchanges, but that information has not been forthcoming from HHS, so we don't know how to apply, when to apply, and what to apply for. I guess the bottom line from my standpoint is there's a lot of unanswered questions, and because we are in a partnership with the federal government, we really have to find out what they are contemplating. And because this doesn't really take effect till 2014, I have to be really honest with you, it is not the #1 focus of our office right now. Our #1 focus in the office right now is to find out what the medical loss ratio will be for carriers, because we have carriers who are currently exiting the market. We just got a response yesterday from a carrier. So we have to be very careful about what actually the market will look like in 2014. So with that in mind, I think everything's very fluid right now. We have some incredible deadlines to meet this year. We'll meet them all. We'll meet the goals of the information exchange here in the state of Iowa. But we want to make sure whatever we're doing it right. So at this point, even with working with Charlie as far as we want our exchange to work very collaboratively with people who are going from public programs to private, we really don't know what HHS is envisioning at this time. So I guess the good news is no harm, no foul at this point. But the bad news is we don't really have a lot of direction on where we should be going moving forward. We hope to have that at least in the next couple of months. Our working group at the NEIC is really trying to put a template, a model together, because we think there are going to be some major changes next year. We know we're going to have a lot of new commissioners, so we want to at least build the base of what we believe our exchanges will look like and then give that to HHS for their comments and thoughts, and then we can move forward.